Pleased to be here to give you an update on two matters in particular. One is the national vaccine rollout and very significant progress over not just the last 24 hours but the course of the last week and a half. And secondly, also to discuss developments in Queensland and New South Wales with regards to the cases following the outbreak there. In particular, I'm delighted to be able to say that we have had a record day for vaccinations. 72,826 vaccinations in the 24 hours to midnight last night, so 72,826 vaccinations. That's showing that the national vaccination program is accelerating exactly as intended, in the manner that was intended, at the time it was intended, off the back of a very clear development, and that is the capacity to have sovereign domestic manufacturing with strong, stable supplies coming out of CSL and Seqirus. And so that is extremely important. That takes the national total now to 670,349 vaccinations. And so what we're seeing is very significant progress. In particular as well, I'm pleased that we've now reached over 99,000 people in aged care, that in particular we have 848 aged care facilities which have been completed, and 279 have now had second doses, and so that's a very significant amount of progress. All of this occurs at the same time as we're seeing global cases continuing to accelerate again. After the reductions from the middle of January onwards, we saw a movement down. Sadly, the last 24 hours have seen over 591,000 cases and terribly over 11,500 lives lost. That takes it now to 1 million lives lost globally in 2021, an almost unimaginable figure. At the same time, we've been very fortunate that through the combined work of the states and the territories, the Commonwealth and so many others, we have been able to achieve an outcome of no lives lost in Australia. And all of the parties who've contributed to that containment are contributing to the vaccination. The states and territories are doing a first-class job. The general practices have stepped up. The Commonwealth is contributing, and all are coming together to see that figure of 72,000 vaccinations in the last 24 hours and 670,000 vaccinations cumulatively. Beyond that, I think it's important to recognise that in Queensland we have seen 2 more cases today. I think we can say that that was lower than many had thought might have been the case. That's a tribute to the contact tracing that's occurring in Queensland and around the country. I think it's a very positive step. We know it's still a significant concern. It's still a Commonwealth hotspot, and that as a consequence of that, we know that there are risks. But Queenslanders are stepping up to be tested. We're seeing very strong results. And a very low number of positive cases which were in any event directly connected with the existing cluster. One case in New South Wales, there's intense contact tracing going on from New South Wales Health, which, as we've always said, has an extraordinarily capable and highly developed contact tracing system. So all of those parts are coming together. It is a matter of concern because it's a Commonwealth hotspot. It is a matter of concern because there are cases, but we know how to do this, and that's what's occurring again. In terms of the Commonwealth action, I think it's important just to set out that with the declaration of the hotspot, there are 7 things that are occurring. 1, the Chief Medical Officer or the Deputy are convening daily meetings of the medical expert panel with the states. The National Incident Centre, number 2, has offered support for contact tracing. 3, the Australian Government's Chief Medical Officer, Professor Paul Kelly, has declared Brisbane to be a COVID hotspot from the 11:59 on the 30th of March, and that triggers a number of things. Provision of PPE, actions for aged care facilities, which themselves have PPE and single-site workforce supplement, assistance with contact tracing, reallocation of vaccine supplies if required. The fourth thing then that's occurred is that we're supporting states with flight manifests. In addition to that, what we've done is that as I mentioned, a fifth element is vaccine reprioritisation to residents of aged care facilities that are in the particular areas. The sixth is that there's Commonwealth-funded asymptomatic COVID testing that's been made available to the public and to the aged care facility staff. And finally, the Commonwealth-funded, as the seventh item, single-site workforce arrangements have been triggered.